Peaks of Health Metabolic Medical Center is all about you. Medical Director Dr. Tracie Leonhardt is back to discuss how they can help you. Dr. Tracie, how are you?
It's good to be back. Hi.
I'll say good to see you, and we love when you come in because you always open our eyes. You're always educating us and, of course, sharing how you can help. But first thing I want to talk about, functional and integrative medicine. What is that? Why do we need to know what it is?
It's like the new buzzwords lately, I think.
Right?
Well, it's an up-and-coming medicine, but it's been around for a long time.
Okay.
You know, it's just now being accepted into mainstream medicine, you know, because now Cleveland Clinic has an integrative medicine, Johns Hopkins is doing it. What it is really going back to basics, I think. We're going back to the physiology. We're going back to why. We're going back, okay, you have blood pressure. Let's not throw a pill at it. Let's find out why. You have diabetes, you know, okay, let's not just keep on throwing insulin and drugs at you. Find out why your blood sugar is not being corrected. You know, go after the insulin resistance. So you're tired, okay, let's find out why. You know, and so we actually start digging down into the system and find out the reason the person has the condition and try to correct the underlying reason instead of just putting the pills on there.
And having you been a regular before on our show, I'm assuming and getting to know you, you got to be so relieved that other people are starting to do this because this is something that you've been preaching for a long time.
It has been. And it's, you know, again, doctors are actually thirsting for this medicine. I teach at 2 hospitals. I teach at a medical school. I have a couple residents with me today, you know, that we actually teach. They're looking for this information, you know, because we've gotten so far into, I want that prescription, you know, and that's what we've been doing for a long time. But now our patients are like, what is my nutritional status? You know, how can I improve my health? We can find disease long before it ever happens by looking at things, you know, and looking at markers that are occurring before the actual disease occurs. Like diabetes, I can find 10 years before it starts. So if we can find it then and correct it, we can prevent that person from becoming diabetic. We just found one of our patients with cancer this week. Well, it didn't show up in anything else. It was showing up in markers. So we were looking at certain markers in her system, and by doing that, we just chased it down as to why that marker was elevated and found that she had early stage cancer. So at that stage, it's curable as opposed to waiting until it actually shows up on that mammogram and everything.
Well, that's what I was going to say. I'm assuming that when you detect these diseases, whether it's cancer or the other examples you gave, early, that's got to help the chances and help the disease from progressing, right?
Exactly. I mean, for those kinds of things, as I said, if you prevent diabetes from progressing, you can prevent cardiovascular disease, hypertension, you know, sugar and insulin also leads to things like cancer down the road. You know, if you find inflammation in that body, you know, and you correct the inflammatory process, inflammation is the hallmark of all disease, just about.
Interesting.
So, you know, we do a lot of hormones and things like that. We do a lot of teaching, a lot of education, a lot of nutritional counseling. So it's so much, you know, we do so many different things. We do a lot of autoimmune diseases. We have an IV room that helps people with nutrition. So people who can't get nutrition through their intestinal system, we can give it to them IV until we can correct the problem.
Well, I'm curious, you know, we're talking a lot about the education aspect, and you've touched a little bit on what you can, but who are you talking out there that's watching this segment? Who are you talking to that should pick up the phone and give you a call? Who's kind of the patient that needs to reach out?
I think that patient who has gone through the medical system and hasn't gotten their answers. That patient that still doesn't feel good. You know, they told their blood work is all normal. That's what we get usually is, you know, I've been to my primary care doctor, I'm not getting my answers. You know, and no offense, primary care doctors, you know, they don't have the time. We take the time to spend with our patients because we allot that time. I don't have to see 30, 40 patients in a day. And by doing that, we can take the time to find the underlying reason. Somebody who's diabetic who wants to change their lifestyle. Somebody who, you know, is being treated but just not feeling like they're, you know, they're where they want to be. So we can start chasing down why, you know, and start correcting those problems for them.
Well, I know you also have a new expansion that you want to talk about, some
do.
exciting things for us. What's going on?
Yeah, we're actually getting ready to open the second side of our building, you know, so we added on an additional 5,000 square feet to the building. So it's going to allow us to, you know, we do training for T pellet hormones. So we have a training center in there. We have a classroom in there. So it allows us to do, you know, lectures and, you know, we do a lot of seminars to the public to kind of educate the public for free. So it allows us to do that in a better setting. You know, it's going to allow us to bring in other services that we really wanted to make an all-comprehensive facility for patients to go to.
Nice. Well, we always appreciate when you were here, but I think most importantly, we need to tell people how they can get in touch with you. If you want to learn even more and see if this is the right fit, in fact, you can get a free 15-minute consultation when you do mention the Morning Blend. There's the phone number. There's the website. Doctor, thank you so much for coming on. We always appreciate it.
Thank you.